Hi, I'm Molly.
And I'm Jamie, and this is our From the Pasture with Hired Hand podcast. As the owners of Hired Hand website software, we've been developing websites and creating internet marketing strategies for livestock breeders for the past 10 years.
The majority of our customers are involved in the breeding of registered animals, such as Texas Longhorns, Highland cattle, horses, and white-tailed deer, where the pedigrees are very important. The From the Pasture with Hired Hand podcast examines many of the differences in raising pedigreed livestock for maximum profit. Join us and learn what we're covering today.
In today's episode, we'll be interviewing Josie Struthoff, who raises Texas Longhorns with her husband Lynn in San Antonio, Texas. Welcome, Josie.
Thank you. I just wanted to give you a little bit of a history about Struthoff Ranch. Lynn and I have been together about 6 years. Lynn has been in the Longhorn industry since the late 90s, and he's been concentrating on breeding the highest quality registered Texas Longhorns. He owns several ranches. The one that we live on is primarily registered Texas Longhorns. We have about over 400 head, and he also owns another commercial ranch over in Sutherland Springs where he farms about 900 acres and has probably 300 cow-calf pair that he does commercial cattle on. So pretty much that's the history of Struthoff Ranch, and we're just trying to concentrate on breeding the complete Longhorn. We have our main herd sire right now that is SR Clout 466. That has been our main herd sire for now. He's producing quite a bit of a brindle, as well as futurity winners as well too. And we also have an up and coming another herd sire, Lexington, who we are going to be having his first babies drop probably after the 1st of January. So we're looking forward to that production. So that's Struthoff Ranch, and look forward to your questions.
Perfect. The first thing is can you tell our listeners why you're so knowledgeable about different vaccinations and your history with that?
Well, my prior life that I had prior to being married to Lynn and the Longhorns, I used to own and run a veterinary clinic for 21 years. My ex was a vet, and I did everything but surgery. I'm not a veterinarian or an expert, but from experience and trial and error, we found this protocol is what has been successful in keeping our herd healthy. We had a 25,000 square foot veterinary clinic that was a 24/7, no appointment necessary, with 6 vets on staff, 65 employees. We saw everything from parvo, corona, heartworms, distemper, gunshot wounds. I mean, you name it, we saw it. So when I started dating Lynn, I had no idea he actually had cattle or Longhorns. And at the end of our dates, he would say he'd have to rush back home to take care of his dog. And I would think, why can't you just put food and water in the garage and stay a little bit longer? But it wasn't until probably about 4 months later was the first time I actually visited his ranch for the first time. And he kind of did this because every time we dated, I was always wearing little black dresses and designer heels. And he was really afraid of, this city girl's going to take one step on the ranch, and she's going to run from this country boy's life. Well, I actually fell in love with him, and I fell in love with the Longhorns. So from my previous training from owning a veterinary clinic, I was accustomed to health and wellness protocol. So understanding that he had all these cattle, I took it upon myself to go ahead and research the common cattle diseases and try to familiarize myself with what we needed to implement, since we had such a large herd and contagious diseases could be catastrophic for the herd our size. So some of the vets that we've had in the area, whenever I started talking to them, they would tell us, well, you don't need so-and-so disease here because we don't have this in Texas, but through trial and error with purchasing cattle, we purchase them all throughout the nation. We try to attend almost every sale. So we had to find some type of a vaccination that was like a full spectrum that covered almost everything to make sure that our cattle were fully protected by whatever diseases of different areas.
That's a great story about how this all came about, how you and Lynn, dated, and it's funny how everything kind of comes full circle, huh?
Exactly, right. I never anticipated that. I didn't think I was going to be doing anything with animals again.
Well, Josie, let's start with calves specifically. What vaccinations do you give to your calves?
Okay. The day that a calf is born, we immediately administer Enforce 3. We give a dose of Multimin 90. We dip their umbilical cord in iodine to help prevent an infection in the exposed navel. ear tag the calf since we have a calf born almost every single day, and many of our brindles start out red until they start developing their defining color markings. We photograph and then record each birth. The Enforce 3 is an intranasal respiratory vaccine, and it comes with a plastic cannula. What it is, you get individual doses where there's a saline and then there's a freeze-dried, and you end up taking a syringe and you poke it in there. You pull up the saline and you depress it into the freeze-dried area. You kind of mix it up, and then you pull it back into the syringe. It's usually about 2.5 mils, and then you put the plastic cannula on there, and you squirt 1 mil into each nostril of the calf, and it helps prime the immune system for a memory response for subsequent vaccinations. This prevents respiratory disease caused by bovine respiratory syncytial virus. The virus that affects the lower respiratory tract when it can cause varying degrees of pneumonia in a calf. The transmission is usually respiratory, is from direct contact with other infected cattle. The symptoms for that are like high fever, increased respiratory rate, spontaneous coughing, nasal discharge. Most of the cases like that, they recover naturally. And it also helps prevent IBR, which is infectious bovine rhinotracheitis, which is also a highly contagious infectious respiratory that is caused by the bovine herpes virus. And that can infect the young and the old cattle. This also is viral. It's an acute inflammation of the upper respiratory tract. After the first infection, the virus is never fully removed. It stays behind in the nerve cells in the brain and is a lifelong kind of a latent infection. At the time of stress, the virus can multiply and can be re-excreted, generally from the nose and from the eyes. This is the purchase of infected animals is the main source of how these new infections come into your herd. The symptoms of this is usually like a fever, coughing, depressed, loss of appetite, lesions, nasal discharge, conjunctivitis, drop in milk production, infertility, and also the animals can be aborted. But there's no treatment for that. What you have to do is remove those animals from your herd. The prevention of this is actually just the vaccine. Giving them the vaccinations will help prevent that. And the third class of disease is the viral as well, which is parainfluenza, and it's an initiator that can lead to secondary bacterial pneumonia. And clinical signs of this are pretty much like fever, coughing, serious nasal discharge, and lacrimal discharge, and secretions from the eyes. The multimin 90 that will help proper immune function, cellular energy, protein production. The trace minerals are very essential for the structural components of the body and hormone production. The zinc will help with reproduction, healthy feet and hooves, skin, coat, and cellular division, and spermatogenesis, the production, the development of the mature spermatozoa. The selenium helps with production of fertility, reduce retained placenta disease, resistance, and embryo survival. The manganese helps with spermatogenesis, the reproduction of fertility, embryo survival, ovulation, and proper bone development. And the copper will aid in reproduction and fertility, reduce retained placenta, disease resistance, and hair color. So in summary, our newborn calves are given a dose of Enforce 3 to help protect against those diseases, a dose of trace minerals, which is the multimin 90, and we dip their umbilical cord in iodine to help prevent an infection in their exposed navel area.
Josie, are these vaccinations, are these combinations that you just talked about, are they available to anyone? Or are they custom? Like, does your vet custom make these for you? Tell us a little bit about where folks can find these.
That particular one called the Enforce 3, that one you can purchase. We usually purchase a lot of our things through Valley Vet. You don't need a prescription for that. That one comes in 2 different sizes. You can either get a vial that I believe is 50 doses, or you can get a individual 25 doses is what we usually get, because typically when you end up reconstituting it like that, you can't really keep it around for more than a day or 2. So we get the individual doses. So when each time a new baby's born, we go ahead and reconstitute one individual vial. And that can be purchased through Valley Vet. You order it one day, it's shipped overnight, and you get it within 24 hours, but that needs to be kept refrigerated. The multimin 90, that you need a prescription from your veterinarian. But that too, we also purchase from Valley Vet, and we have our vet just call in and have a prescription on file. And that is sold in either 50 doses, a vial that size, or 500 doses. We end up getting usually several of the different sizes because, like those two, is when they're depressed, when you stick a syringe in there, typically you don't want to have that depressed vial sitting around for more than 30 days. So for the individual babies, when we're working the entire herd, we go with the 500 because we have over 400 animals where we're going to utilize probably 8 bottles of that over 2 days, whereas when we're individually injecting a newborn baby, we try to go with the smallest dose possible so we don't end up wasting the rest of that. And then the iodine, we end up purchasing that too as well from Valley Vet as well too. You can buy that in 32 ounces. You can even buy it at the grocery store, but we try to go with the 7% that uses a surgical scrub, but that too we end up purchasing through Valley Vet.
So one of the things you mentioned when you were describing your process is that you all go out every day. So you have calves born every day. I know that some of our listeners, they're not able to check on their animals every day, whether it be they have a ranch hand, at the ranch that does it, or maybe they're only out to their property a couple times a week. What would your advice be for someone that can't, be there every day to check? Are these vaccinations still viable after the calf is a few days old, or what would you change?
The most important thing would be within the first 24 hours. However, you're still able to use it all the way up to 3 months. And they end up saying, too, on the informational package that it's best to give them a booster at 3 to 4 months. So it's most important at the very beginning, but however you're not able to do that, it still will help their immune system, even if it is 1 or 2 months later.
Okay.
Are there certain vaccinations that are given to heifers before they start breeding?
Absolutely. We end up giving our heifers a booster of the 2020 Vision 7 and the ViraShield 6 plus VL5. The 2020 Vision 7, that pretty much covers, when they say a 7-way, there's different types of Clostridium. There's about 7 different types of them, plus the one that we use. They also have, when you say 2020 Vision, that is actually Miraxilla, which is the pink eye. So it's for 7 different types of Clostridium plus the pink eye. And when they say with spur, it's just an adjuvant that helps the immune system process it. So the heifers are given the 2020 Vision. They're given also a ViraShield that protects against 5 different types of leptospirosis. In addition to that, we ended up adding a new one that has HB somus. We recently had a heifer that had passed away. She had pneumonia. We didn't quite find out what it was, but now every animal that we have autopsies done on it, and they take a tissue sample of every single tissue on the animal, and they send it away to test to see exactly what was the cause of death. And this one turned out to be histophilosomy, which can cause hemorrhaging within the muscle tissue on the animal. It caused scar tissue in the heart, scar tissue in the lung. Had we been giving this HB somus vaccination in our ViraShield 6 plus VL5, it would have prevented that as well too. So now that we know that, we increased our coverage of the ViraShield from going from ViraShield 6 plus VL5. Now we also added the ViraShield 6 plus VL5 HB somus. So now we vaccinate all of our heifers with the 2020 Vision 7 with spur, ViraShield 6 plus VL5 somus. In addition to that, we give them the Multimin 90, which will help with all the pregnancy, and also a dose of the long range. Every single heifer prior to being sent out to the bull is given a booster of all those immunizations.
Oh. So are there basic vaccinations or medical procedures that you follow on an annual or seasonal basis for your herd when you work your entire herd like you mentioned?
Yes, there are. We run our entire herd. We have over 400 through our Joe Shoot in 2 days. This is done twice a year. The first part of the year, which is usually April, May, we'll run everything through. During this time, every animal is weighed. The horns are measured, except the calves that are under 6 months old that are not yet weaned, but they are given the weight and the vaccinations as well. They're vaccinated with the 2020 Vision 7 with spur, the ViraShield 6 plus VL5 HB somas, Multimin 90, cows and heifers are injected with a long-range wormer. The bulls, it's not recommended as it could affect their semen. It can lower their semen count. And also, they're given Epernex, a Poron as well, and they're given cleanup or they're given silence to end up treating for lice and things like that. It sounds like an overkill, but this process for us has really worked. The vaccinations on the cows and the breeding bulls are done annually. The weaned heifers and bulls are given a booster, 2020 Vision 7 of Virus Shield, 6 plus CL5, HB Somanus. That's pretty much the protocol that we end up doing. So the second time of the year, which is usually November, December, at that point, whatever calves were given a booster, but all the rest of the cattle, they are given the multimin 90. They're weighed, the horns are measured. This way we can end up assessing the growth of the horns, whether some of the animals within the herd, whether we should continue breeding them or whether we should just go ahead and cull them if they're not producing either one more calves or two, whether their horn development is not quite where it should be.
Have you had to adjust this process over the years? Like, are there things that you learned from that work better that you've improved upon, or is what you just explained how you've always done it?
We ended up changing things over time where we also, in addition to the spring measurement, we've included hip height as well too. Because with our animals in the industry, we've noticed that there are breeders that breed for horn length. There are other ones that breed for the stock shows, the show circuit. We're trying to produce the complete animal to where they're big-bodied. Our term is bone-button body. We want to be able to produce the complete package that has the depth of body, the big butt, the strong top line, horn development, and color on top of that as well too. So in addition to this year, we also added in hip height as well too, because we wanted to make sure that the data that we were studying was very complete, which the hip height will show you the height of an animal. You see in some of these photos that are on the internet that people end up studying the different animals and different herd lines, where it's very easy to take a photo of an animal from the ground up or to be able to see in the photos. It's not until you actually see the animal in person of what their true stature looks like, because it's just very difficult to catch that depth in a photo. But with a hip height, at least when you have this information, you have an accuracy as to how tall, they actually are, as opposed to something you might misinterpret or see on a photo.
Mm-hmm. So earlier you mentioned how you give some shots to the cows, but not always to the bulls. Are there other vaccinations or medications that you give only to the bulls and not the cows?
The bulls that we in addition to them, we also give a tetanus shot to the bulls. Since we have such a high volume of calves that we wean, the little bulls, sometimes you will see with us, we can pick out a bull usually within the first week, whether it's going to be a future herd sire or not. They'll have that big thick neck, the big head, the squared up body, whereas some of the other bulls, they'll have more of a feminine base where that tells us that needs to be a steer. So when these little bulls are weaned, we end up giving them a tetanus shot at the same time. This way, 30 days later, when we decide to go ahead and steer them, they're already given one dose of tetanus, and then the next time we actually go to steer them, we give them another injection as well too, because when they're castrated, it can introduce tetanus to them with them having an injury and laying on the ground, and they can end up getting tetanus. So the difference is with the young bulls, when we wean them, we also give them several doses of tetanus.
Love what you're hearing? Be sure to check out our Pickup Truck Confessions.
It's a video series where we hop in the truck or rental car and interview a variety of breeders about what drives their passion for their livestock, how they got started in the breed of their choice, marketing tips, and more.
And now, back to the podcast.
So what other processes that you haven't already covered do you and Lynn also do to keep your herd healthy?
For Lynn and I to maintain a healthy herd, especially the size of ours, we adhere to a strict protocol. For every animal coming into our property or going out that's sold is quarantined. They're tested for brucellosis, tuberculosis, Johne's, BVD, and pregnancy. They are given our standard protocol vaccination. with the multiminidae and also wormed. To help with fly control, Lynn constructed these squares, these made out of steel, around our automatic waterers. Attached to the top of these are cattle rubs with strips of material hanging down about every 4 inches that go down about 12 inch, a whole foot. During the spring warm weather, when the fly population increases, we douse these cattle rubs with prolate, and it's an insecticide that's mixed with diesel fuel. And when the cattle come to drink water, they have to walk under the rubs, and this mixture is rubbed on their backs and their horns, and it helps control the flies. It keeps the flies off of them. In addition to that, we keep year-round the Purina Wind and Rain mineral tubs that has Altocid. Altocid is an insect growth regulator, and it prevents adult flies emerging from the manure of treated cattle. It passes through the animal and into the manure where the horn lays their eggs. It breaks the hornfly cycle by preventing the pupae from developing into biting adult flies. We also spot treat with just the regular horse Pyrana spray in a bottle, or our cattle, whenever we go out into the pasture with one of the rangers, they come running up to the ranger, hoping we're going to be feeding them cubes, which we usually do on a daily basis anyways, to try to keep them calm and used to having people around and handling them. But sometimes some of them don't go under some of the waters the way they should, and we end up taking the spray bottles, and they're so close to us like that where we end up spot treating them with a spray bottle as well too. We've also used the vet gun where our old steers that are 19, 20 years old don't come running the way the rest of the herd do. But those two, I hate to use those because it does make them a little shy and coming around you because they see the gun and they've had it before, to where we try not to use that unless it's an animal that is just completely covered in flies. But it does take care of them for probably 3 or 4 days. But every loss of an animal is a learning experience for us, where we've had a couple of calves born with a cleft palate. The calves that are born, they visually appear very normal, but upon further scrutiny, they never seem to gain weight and they die within a week or 2. After the first loss that we had about 5 years ago, I checked every newborn while administering Enforce 3, a multi-min tagging protocol, to ensure that their hard and their soft palate are completely closed and not cleft. The calves with a cleft palate, they'll have difficulty in drinking milk, and much of what they drink will come out of their nose because they don't have a way to close off their nasal canal to their mouth. When studying the genetics of the dams, I've never had a history of cleft palate in some of these dams, so I would look at it environmental-wise of what have caused this. There's chemicals in weeds that are teratogenic, and the agents can disturb the development of the embryo or the fetus. The teratogens can produce birth defects. We used Grazon one time to spray the weeds in one of our hay pastures, and we never removed the cattle from the grazing. We had several cows that were between day pregnancy 40 to 100 while the fetus was developing. Caused a deformity in the cleft palate. Then we switched to Cimarron, and we didn't have any more cleft palates. But as much people love bluebonnets as well, these can be teratogenic as well too. We lost a calf this past year that had lupine poisoning. The dam, she was kept in a pen that was contained with many bluebonnets, and she was bred there and kept there for the first 5 months of her pregnancy. And when the calf was born, it had severe lupine poisoning, like with the ankles of the feet. They're turned inward and they're very large. They look kind of like a club foot, but this was the cause of lupine poisoning. It was from the mother eating the bluebonnets while she was during day 40 and 100 of the development of the calf. But the calf, unfortunately, had to be put down. So since then, we don't reseed for bluebonnets, and we try to keep our cattle away from them during the spring.
Those are all things that, it's great advice. It's too bad that you've had to learn from some of them, but, sharing this hopefully will prevent, some other people from having to learn the same way that you did. So thank you for that.
Sure. It's like each one, like I say, every loss is a new experience, and we, hope to share our information. So when people do have these deformities or do have something, that at least they could have something to fall back on to be able to, well, maybe this is the reason why, or trying to prevent that from happening to anybody else.
Exactly.
Are there other vaccinations that not everyone maybe gives, but you believe are just as important as the vaccinations that are more commonly used?
I think most of the industry has caught on to how important vaccinations are. Other than the usual 7-way virus shield that Lynn and I have seen, we've seen the results in the development, body and horn-wise in our cattle, is the importance of multimin 90 and the Purina Wind and Rain mineral. I mean, we've noticed a significant difference in the development of the horns and the body as well, and nutrition.
So Josie, we've talked to you quite a bit about your protocols for when you either bring an animal into your herd that you purchased from a consignment sale, or when you and Lynn are getting ready to sell an animal at a consignment sale. Walk us through a little bit about that process in terms of what's required, but also what you all do above and beyond that to ensure the overall safety of your herd or the herd that you're selling an animal to.
Okay. Typically with these breeders' sales that we go to, when we end up getting the information together for a consignment, on these consignment papers, what we typically see that is required is within 30 days of the sale is a brucellosis and tuberculosis test is all that we have, and some type of a pregnancy check to see whether the animal is a breeding animal. We try to go the distance to ensure the potential buyer that the animal that we put into consignment is disease-free as well too. Typically at cattle sales, what's required is to have the health paper with your veterinarian stating on there the results of the caudal fold test of brucellosis and tuberculosis, stating the results were negative. The consignment cattle's OCV tag number, the name of the cow, or the description, the age, the OCV tattoo. Every single calf, when they have their official cattle vaccination, they're vaccinated against brucellosis, and they're given a tattoo that they put in their right ear that usually is our shield, an RV, and then it has whatever corresponding year that the animal was weaned at that time. Like say this year, a heifer is given her OCV vaccination and tattoo. It would be RV9 for 2019, and whether also the animal is pregnant or not, whether it was palpated or whether it was blood tested, negative or positive. In addition to that information, we end up giving as well as the Yoni's test. We've purchased several animals in sales that unfortunately tested positive for Yoni's. We ended up doing a blood ELISA test, which just tells you whether they do have antibodies, and we also do the fecal PCR, which lets you know whether the animal is actively shedding. With the Yoni's, it's transmitted by the milk, and it's also transmitted milk, colostrum, and feces as well too. And you don't want to have that in your herd. It is not curable. In addition to that, we also test for BVD. So with the cattle sales, they only require brucellosis, tuberculosis, and whether the animal's pregnant or not, whether it's open or pregnant. With our animals that we put in, we will do the brucellosis, tuberculosis. We have them blood tested, palpated. We have them tested for Yoni's, and we also have them tested for BVD, just trying to cover the full spectrum, letting the person know that this animal is healthy, whether they are a breeder, giving them that information to try to cover all bases.
I noticed that you all always also say that in the sale catalog comments, right?
That's correct.
So earlier you mentioned having a commercial herd. Are there special vaccinations that you give only to your Longhorns that other cattle don't receive?
The only special thing that we give them over what we give our commercial herd are the cleanup for lice. We end up giving them also the Purina Wind and Rain that has the Altocid in there as well too. Those are pretty much the only different things that we do for the commercial, for the Longhorns that we do over the commercial. So almost everything else is the same other than the cleanup and the Purina Wind and Rain with the Altocid in it.
Are there certain medications that you always have on hand that you find come in helpful or that might be needed in an emergency situation?
Absolutely. We have Draxin, which is used to treat some type of a bovine respiratory disease, conjunctivitis, foot rot, pneumonia. That usually we give with probiotics as well too, because it is kind of hard on the stomach. So that's pretty much more for the older cows. The young little calves, when they're presenting bovine respiratory pneumonia, we'll give them Baytril 100. We always keep that on hand as well too. We keep penicillin. We keep colostrum on hand. So in the event, like we had a cow in calving distress where the mother did not claim the baby, at least this way, we immediately have some colostrum that we pull out of the refrigerator and we're able to mix up and make sure that the baby's immunity is started from day one. We also keep milk replacer on hand. Usually these type of things we keep in the freezer so they last longer than the shelf life of keeping at room temperature or refrigerator. We keep electrolytes. We keep casting material in the event of a horn injury. We've had that once before where a cow would end up injuring at the base and we're able to put a casting on it, and then 6 months later it falls off and it's completely reattached normally. But it's just like that regular casting material. That's another thing you can purchase online. There is also reabsorb electrolytes for scouring calves. When some of these calves end up getting pneumonia, typically in the spring or when it's really like what we've had, cold, rainy weather, some of these calves that are not vaccinated would come down with pneumonia, runny nose, scouring. These electrolytes, we'd either give them with a bottle, which they're very eager to suck down when they're not feeling good, or some of them have actually had to be esophageal feed them the electrolytes. When they have pneumonia, they have the runny nose, they're scouring, they're depleted of their electrolytes. We end up giving this to them. We also have Save-A-Calf Scours and Pneumonia Treated Medicated Calf Milk Replacer. This is something they pulled off the market where anybody could purchase it over the counter, and this worked great, especially when we had calves at the same time when it is cold and rainy, they develop pneumonia. This one here, we would end up giving the babies that has antibiotic in it, but you have to have a veterinary prescription as well too. You purchase it in like 5-pound bags now. Every single calf we've had that had pneumonia prior to the protocol that we had would end up dying from scouring so bad. And when we use this milk, every single animal we had that had pneumonia would make a complete recovery. And we keep this on hand at all times, and we keep it in the freezer as well too, because it lasts probably up to a year. And that is just like a regular milk replacer. However, it has antibiotic in that. In addition to that, we also keep thiamine on hand. We keep B12. We keep Banamine for the control of fever. Whenever these calves would have pneumonia like that, we would end up giving them a shot of Banamine. We also have Multimin 90, Estromate, Cistrellin, Ludolase, and Exceed. These are pretty much the prescription medication that we try to keep on hand.
For our listeners who might not have an eye for those sorts of symptoms yet, can you explain a little more in detail what you look for and what some of the warning signs are for an animal that might be, getting sick or in distress?
When you end up seeing coughing, although sometimes coughing can also be when they start eating grain. If there's a lot of powder in there, that can cause coughing as well too. But when you start seeing that the animal is listless, not as lively and active as they normally are, when I started really paying attention to taking over the care of the animal 6 years ago, it took kind of a drastic measurement to where my analyzation at the time was I would see an animal down on its side. Well, that's like almost a little too late. You have to start paying attention to watching nasal discharge, watching to see their body. Are they getting thinner? Are you seeing them bony? Do they seem listless? You pull up the skin and let it go to see is it hanging on them? Is there a fast the skin bounces back. You start noticing about their hydration levels. So because if you're pulling the skin and it doesn't pull back to the body quickly, the animal is dehydrated. Taking a look to see, do they feel like feeling their ears? Do they feel really, really hot? Their normal temperature, I believe, is about 103, 104. When you start feeling it much, much hotter than that, we usually keep digital thermometers on hand as well too, and we'll end up taking the rectal thermometer to see what their temperature is at. Now, having all that experience now is kind of automatic, but in the very beginning of just paying attention to how they respond. A baby should be active, should be running around. When you see them not running around, you see their body is not, their conditioning is they're getting thinner. Those are alarming things to start paying attention to, checking to see are they milking. Maybe the mother's not a good milker. If you know the mother is a good milker and they're still not gaining weight, you know there's something wrong.
Is there any other advice that you'd like to give or share with our listeners that you think would be helpful?
If there's any questions or any information that they would like, we'd be more than happy to try to share whatever experiences, whatever information we've learned. We're always researching, always willing to take a look at new medications, new vaccinations, and appreciate anything that anybody can share and try to help any person who, would like to know more about anything that we do.
We'll be sure to link to your website and also your email address in the show notes so that, folks can reach out to you if they would like to learn more.
Great. That sounds wonderful.
Well, thanks for joining us today, Josie. We really appreciate it.
You're very welcome. Thank you for asking me. I'm very happy to share any information that we learn and to help breeders in any way we can.